Okay, so hello everybody and welcome to DEA's After Hours webinar, Fracking with Our Health. My name is Kate Wiley. I'm a GP and Executive Director of Doctors for the Environment Australia, and it's my great pleasure to be facilitating this webinar this evening. I first want to acknowledge that sovereignty was never ceded and pay my respects to First Nations people all across our country. I'm on Tandanya on Ghana Yurta, which is otherwise known as Adelaide, and hello to a group in Ghana is Namani. So Namani, and thank you for taking the time to be here this evening. I also want to acknowledge the climate emergency. You know, we live in the most interesting of times. What we do this decade has a massive impact on the future health and well-being of our planet. And, you know, I'm very happy that this, well, happy is the wrong word, but I'm very excited about this webinar tonight that might help us, you know, do something good for our planet. As far as housekeeping is concerned, obviously you can see there's a Q&A feature down the bottom. I ask people to put their questions in there, and at the end, you know, we'll have questions to our panelists. Also, the chat feature's there, and I do encourage people to use the chat just to, you know, talk amongst yourself and have this sense that there's people here together doing this, you know, on this journey with this webinar. Okay, also, if you are an RACGP or ACRA member and you want to get your points, I'll put the link to the form in the chat. I need you to fill out the form. Please fill out the form. All right, thank you very much. So now I'd love to introduce our panel. I'm extremely excited to be joined by these three fabulous people, absolute experts in their field, and have got so much knowledge and wisdom to impart on us. And I'll just introduce them by name, and then we'll get on to the webinar. So first I've got Professor Melissa Hasswell. Hello, Melissa, how are you? Melissa is Professor of Practice in Environmental Wellbeing at Sydney Uni with a portfolio of the Deputy Vice-Chancellor, Indigenous Strategy and Services and School of Geosciences. It's quite impressive. And then we have Mr. Jacob Hegedus, who's a Research Assistant with the Deputy Vice-Chancellor's Indigenous Strategy and Services group at Sydney Uni. He's a Gumbaynggirr man from the Northern Rivers, and his community has had its own experience with fracking and have been very successful with that, which I think is, you know, quite an impressive thing. Lastly, but certainly not leastly, Dr. Anna-Greta Hunter, physician, cardiologist, and Human Futures Fellow at ANU College of Health and Medicine. So thank you all so much for being here this evening. So what we're going to do, first Anna-Greta is going to speak, present about climate and health and lace and groundwork, and then Melissa and Jacob are going to take over and talk about the health impacts of gas extraction. All right, thank you both. Thank you all so much. That's fabulous. In your own time, Anna-Greta.
That's fantastic. Thank you so much for the welcome, Kate. And really, it's great to be here. Thank you to DEA for hosting this tonight. It's really such an important topic. It's such an important moment in time. I would also like to start by acknowledging that I'm on Ngunnawal land, country that was never ceded. And I find myself frequently reflecting when I'm given opportunities to spend time listening to First Nations voices, just how much we learn about the relationship between environment and health and human health and survival, human health and existence. We can learn so much by listening to that voice, and I really do hope we say yes. I also know that that deep understanding of environment and human health are things that we're still learning in the medical world. And so I'm going to spend today a really short period of time because I want you to hear as much as we possibly can pack into an hour from Melissa and Jacob. The work that they've been doing looking at the health impacts of gas fracking is just remarkable, and I really want people to hear as much of that as possible today. But what I'm going to do, or try and do quickly, is to give you some scaffolding. So I know that the audience tonight is made up dominantly of healthcare professionals, and I apologise for those who are on the call today who've heard me say some of what I'm going to say previously. But what I want to do is give you a framework that I hope is useful in a couple of different contexts. That hopefully it's useful when you're looking after patients, when you're working in communities, when you're looking at the relationship between the climate that is changing, the sorts of weather events that we're experiencing, and the health impacts that you see in the community and the people that we care for. So on a clinical basis, I hope the framework is actually really useful. I also hope that it's useful in the advocacy, and there's never been a more important time, I think, for us to be really highlighting the key relationship between the health impacts of climate change and the really the negligence really of expanding fossil fuel projects at this point in time in human history. And so I might just start, everyone has seen stuff like this. So let's just contextualize where we're at. Kate's described the climate emergency. We certainly live in unprecedented times. In the last couple of weeks, I've given a few medical student lectures, and I've I had to edit this slide for the 2 different lectures only a couple of weeks apart because of the unfolding unprecedented events. We've seen heat records fall around the globe, and of course that first week of July was the hottest on record for probably many hundreds of thousands of years. Just say that again, hundreds of thousands of years. We've seen extraordinary heat temperatures breached around the world, and not just in one place, but across multiple continents. We've seen the bushfires unfolding in Canada in a way that we've seen, and it is eerily familiar in the Australian context. We've seen extraordinary floods, fires, heat waves. And of course, just in the last week, we've seen these sea surface temperature anomalies, and that Florida temperature, underwater temperature of 35 degrees Celsius. We've seen some commentary around really quite catastrophic type tipping points for climate change, and the possibility that we're beginning to see these things unfold. And in the middle, there are some fires from Greece, which are extraordinary. It's probably past time, but it's certainly time right now to take this seriously. Climate change is a major health threat around the world today and into the coming decades. So it's an important time for healthcare professionals to feel equipped in this space. And so my discussion tonight is really to make an argument for a paradigm shift in the way that we think in healthcare. And I'll take you through the background thinking, the way in which my brain has come to this, for the last couple of years. I'm just a cardiologist. I work in clinical practice here in Canberra. I also have worked in regional New South Wales. I've looked after lots of different rural communities, work I really love. And it was January 2019 where I started to think really seriously about the health impacts of climate change. And I did that here in Canberra. So this is the season before the Black Summer. We normally have a reasonably hot summer here in Canberra, but it's not that hot. And in January 2019, we had this unprecedented 3-week heat wave. And I thought, as a cardiologist, I spend a lot of time talking to people about exercise and physical activity. We all know, those who are working clinically, how important it is in the maintenance of a whole series of chronic health conditions, from heart failure or atrial fibrillation to hypertension to mental health, to COPD, to just our general overall health, our bone health, our bodily function. And so I usually encourage my patients to be doing some sort of physical activity regularly. And in January 2019, I stopped. I spent 3 weeks telling people to stay inside because it was unsafe to go outside to do any sort of physical activity. So I thought to myself, wow, well, if this is happening regularly, then what will happen? And again, we're doctors, we know what happens when we see our patients who are prescribed bed rest and who spend long times in hospital or spend a good amount of time without exercise. It almost accelerates the aging process. We see loss of muscle tone and strength, we see metabolic changes, we see blood pressure and heart rate regulation change, we see mental health impacts and bowel and bladder function, chronic disease management, but particularly the heart and lung disease that I've mentioned, and depression and anxiety. The risk of falls, of course, increases. Why am I putting this at the beginning of a talk about gas? Because when the environment changes, it doesn't impact on one small part of our health. When the environment changes, it influences all of our bodily systems. It influences health from the small people to the big people across all spectrums of disease and all spectrums of presentation. Of course, it was Black Summer soon after that, January 2019, that took what were future conceptual risks to a very much here and now moment for us. And I think it's very reasonable for us to make the case now that it's more than 50% of Australians who've now been directly impacted by a catastrophic weather event that is in some way fueled by the anthropogenic climate change or the greenhouse gas pollution that we have put across the world over the last decade or so. Black Summer, of course, is the remarkable event, more than 12 million Australians breathing the hazardous bushfire smoke from that period, and causing, again, across the spectrum, mental health and distress, changes to physical function, heart attacks, arrhythmias, lung disease, hospitalisation, infections. And we suspect, but we are still learning about what the longer term impacts might be. Of course, our Black Summer happened again quite soon thereafter and is happening again. And so it's not a pattern of this is becoming a new normal. It's a pattern of increasing extremes. And that's what the climate science says. The climate science says, don't get used to this. Get prepared for bigger, for worse, for more extreme and more frequent. What are the other health challenges of climate change? Well, drought has both serious physiological impacts as well as mental health impacts for communities, and anyone who's worked in rural or regional health will particularly have seen this. Floods and storm damage affect our health and well-being, and we saw that soon after our Black Summer as we watched the extraordinary, unprecedented flooding across northern New South Wales and Queensland. This question of how towns run without water is really interesting, and I was reading that piece in the New York Times about the town running out of water. This, of course, happened in Australia in 2019. We had a multitude of towns around New South Wales and Queensland that ran out of water. There were some pretty interesting questions about how to run a hospital service in that context, and questions that I think are unanswered. We see changes of patterns in disease, and often when you talk to people or hear people talking about health and climate change, they will start with vector-borne disease. I think it's a part of the puzzle which is important, and certainly as La Nina unfolded in the last few years, predicting a change in vector-borne disease, and we saw it with Japanese encephalitis, we will see the change in patterns of disease associated with the extraordinarily wet and humid conditions. So heat, I think, is the dominant risk in the Australian context. It's a really serious health risk. It's the natural event that has the highest mortality in the Australian context. We've got a little bit of data out of ANU that suggested that it was around 2% of our mortality has the imprint of very hot temperatures on it. But that's not reflected in our health data. And again, I'm asking a group of healthcare professionals tonight to think about how we connect the environment and our health in our routine clinical practice, in our data collection, in our health service delivery, and in the way that we think so proactively about preventative and maintenance type healthcare. Very high temperatures are emerging as a challenge for human habitation in parts of Australia, and this is particularly relevant as we talk about the Northern Territory. When we talk about 1.5 degrees of global warming, particularly as if we can control that, it does, of course, mean that we should understand that there is regional variation in temperature. And 1.5 degrees of global warming is an average temperature across land and sea. So that includes the ocean temperature will tend to be colder and the land temperatures that are often warmer. And it's averaged across the two. So land temperature is higher than 1.5 degrees, if that's where we're going. And then on a land mass, we will see regional temperature variability. And of course, in a country that's as large as Australia, that will be particularly prominent as we head towards the equator. And so the central part of Australia and the northern part of Australia is extraordinarily vulnerable to increase in temperature. 1.5 degrees, certainly 2+ degrees in the Northern Territory context is extraordinarily difficult and raises some significant questions around habitability in that medium term. So a couple of years ago, we did this thing about calling to add climate change to death certificates, and we weren't actually putting it on there as the primary cause of death, and I've never done that myself. But it's really charging us as a healthcare profession to think deeply about the way in which the environment is changing patterns of disease, the way in which it's impacting on the health and well-being of our population. So what models do we use routinely? Well, there's extraordinary literature out there, and I'm not going to give you a complete overview. There's way too much. Some of the highlights, I think, include all of the extraordinary work done by the Lancet Countdown. And if you're interested in checking that out, there's the Australian version that's coordinated through the MJA. But the Lancet Countdown on an annual basis provides extraordinary documentation showing that association between climate change and the health impacts. And this is some of the models that have been designed by that Lancet team. I'm a fan of the Kate Raworth, or at least the planetary boundary model for economics. And Kate Raworth wrote a beautiful piece in the Lancet in 2017, asking us to think quite differently about health as a entity that should be sitting quite nicely within the planetary boundaries, including issues around climate change, chemical pollution, etc. But I'm a cardiologist, so I'm a pretty simple sort of a person, and I like to reduce things to very easy metrics, things that I can understand and remember. And so I've been thinking about this particular model, and I hope this is familiar for many people. At medical school, and when we're looking at our diagnostic categories, we think a lot about the biology of disease. Well, this is where we put heart disease and atherosclerosis and hypertension and smoking and diabetes. It all sits within a biological model, the biomechanical model of disease. So this is core business for healthcare practitioners. It's extraordinarily important in what we do. It underlies our pharmacology and often our device therapy and other interventions. Core business. But when we look after patients and we're working in communities, does this explain all of the disease that we see? It doesn't. And most of us, as we come out, particularly from the medical school context and begin to work with community, work in hospitals or working in different geography, we begin to appreciate quite quickly that this social determinants of health drives so much of what we see. It drives the premature disease, it changes outcomes in terms of the patient's experience. And so the social determinants, I know you all know it, issues like socioeconomics, geography, employment, relationships, housing. Tremendously important. And in cardiovascular disease, if we look just at the biology of hypertension and diabetes, we don't get a full explanation for coronary artery disease. And if we widen our view out to look at the social determinants as well as those biological factors, we see a much richer picture of the reasons why a particular patient may be with us and the sorts of things that we can address. But we also see a much richer picture of our community and where we can intervene. But that biopsychosocial model, which is really familiar to us and has been part of medical education now for a while, is also incomplete. It's the bit that sits outside it. And this is the bit that we're going to be talking about. In fact, we're going to be talking about all three layers, I suspect, tonight. But it's the environmental influence that sits outside that, that's bigger than us. The planet is bigger than the human that sits on it. It's bigger than the biology of our disease. It's bigger than the social determinants, and it has a strong influence across all of those elements. So this biology, society and environment model, I find really straightforward. It's probably incomplete. There might be much better models that are out there, but if you find it useful, please use it because I think it is helpful. And as you're listening to Melissa and Jacob tonight, see if this model helps you in compartmentalizing the information and the rich discussion that I know we're going to have. Within the environmental health influence for health and wellbeing, again, there are models that are almost certainly better, that are more complex, but I take a fairly simplistic view. So there are three elements that are related to the environment. The environment gives us the climate broadly, it gives us weather events more discreetly, and it has a strong influence on the biodiversity in which we live. And that is fairly central to our health and wellbeing. And then on top of it, there are the variables, the air that we breathe, the food that we eat, and the water that we need to survive, those air, food, and water. For those medical practitioners with us tonight, you might like to reflect on your time at medical school and just how much attention was paid at the medical school level to air quality, to food quality, to water quality. I don't think we taught it. I always think we still don't teach it very often because we assume, as a fundamental, completely essential building block for human health, we assume that it will be good, that it's not an issue, that it doesn't influence, because of course it has to be there. But it's these variables, the air that we breathe, the food that we eat, the water that we need to survive, which are profoundly impacted by the changing climate, by environmental degradation, and by the sorts of challenges that we're seeing unfold around the world. I actually put where and how we live, which is not just housing, it's the structures, it's the communities, it's the dynamic relationship between environment and a human group along into my environmental framework. And I know it's probably a social determinant of disease, but I think this is how we either improve our resilience in the context of extreme weather events or how we find ourselves more vulnerable. So I tend to throw it in there for good measure. And that's my model. So the biology, society, environment, the air, food, water, where and how we live. I hope those ingredients are useful because I'm very much looking forward to listening to Melissa and to Jacob talking about the health impacts of gas fracking in the Beetaloo.
Thank you so much, Anna Greta. And I have to say, you know, the air, the food, the water is something we learn in primary school as things that are needs for humans. And then everything else is a want, you know, and shelter. And somehow we've got so sort of complacent and, you know, arrogant about that we've lost sight of how intrinsically important they are for us as humans. So yeah, thank you so much for that, Anna Greta. That was a very engaging, helpful thing to start us off with. And then Melissa and Jacob, when you're ready, if you're happy to share screen, please.
Perfect. Thanks for that introduction, Kate. Hello, everyone. How are you all tonight? Thanks for joining in with us. My name's Jacob Hegedus. As Kate mentioned, I'm a proud Goombanga man from South Grafton, Coffs Harbour area, for those who are a bit more familiar with that. And it's an honour to be here with you tonight. Before I start, I'd like to acknowledge the traditional owners from all the lands that we're joining in from today. Melissa and myself are up here on beautiful Yagara and Turrbal country up in Brisbane. And yeah, it's an honour to be here with you tonight. I thought I'd start off by, there was a lot of talk there about necessities, and we've started to really take for granted some of the necessities like food, water, and air. And I wanted to share some stories from my area of the world, the Northern Rivers, where I was, proud enough to and luckily enough to grow up. A big part of the Northern Rivers community is farming. Huge dairy and Angus farm communities in that area, and the introduction of CSG and fracking in that area was one of the biggest concerns that really set in motion this pushback against this industry. Sorry guys, we're having the typical technical difficulties.
Sorry.
Yeah, so as I was saying, growing up in the Northern Rivers, I was privy to first-hand experience of this great pushback against this industry from a very, very big region. Earlier this week on Monday, I had the honour of sitting down with the New South Wales Senator Sue Higgins for the area, and I really got to pick her brain about what was the community drive that brought everyone together, and why was this such a substantial pushback against this industry where it hasn't been so much, maybe more southern towards New South Wales or inland Queensland. And a big, as I said, a big push for it was the necessity of farming in our area. As I said, Angus cows, dairy farming, but she said it was one of the first times in history that different socioeconomic groups and different political views had actually come together to fight one big industry. We had the farmers' unions, the community members, and the Aboriginal people all coming together to fight this industry because they knew how destructive it could be. And I've put down here a little snippet from the wonderful company Lock the Gate. They're just one of the many organisations that are fighting this industry around the nation, but they were a huge help. And all them yellow signs you can see is Lock the Gate. It was an outstanding amount of support against this industry in our region. And it's something that I hope, would set a beacon of light for the rest of the country, and just how, progressive we need to be fighting these people. Now, of course, logistically and case by case, there's advantages and disadvantages of every fight around the country. And one of the advantages that everyone in this region had was logistically, they were just so close to each other. And what Sue mentioned to me was, there were fracking wells being proposed only 15 minutes out of town. So a lot of community members could actually come, stand, lock the gate, and then head to work. And it was, very rotational in their approach. It's something that I think they're very lucky in that, there's not a lot of communities around Australia that have that logistic capability. And particularly when you start looking to the Northern Territory and the plans for the Northern Territory, you could never imagine the logistical nightmare it would be to try and organise these sort of rallies in that area. So yeah, as a community member of this region, it was majorly important and so inspiring to be a part of this. But as an Aboriginal man, it's more than just the physical and the tangible destruction of our being. For Aboriginal people, and I think the mental health aspect of a lot of literature that's now coming out is it's the social, it's the psychological, and it's the spiritual, detriment of this industry as well. It's not just Aboriginal people that have connections with the land, it's everyone now has a deep connection with this country. And there are definitely spiritual connections that are being broken by this industry, continuing down its way. So that's a little quote I've put down the bottom from Uncle Sam up in the Beetaloo area. And, as he said, it's not just the physical destruction of country. You are literally ripping out a piece of history. You are literally ripping out a piece of culture and destroying what people hold so dearly, particularly when you get to remote and country communities, people that live off the land still and love the land like it's their firstborn son, it gets very, very personal very, very quickly. So I'll pass it over to Melissa now to talk in depth about some of the literature and the statistics we've been reviewing over the past couple of months. And yeah, take it away.
Thank you so much, Jacob, and hello, everyone. I'd also like to acknowledge the Yagara and Turrbal people on whose land we're sitting here tonight and pay respects to their elders past, present, and emerging. So I'll just say that this is actually a huge landscape that we're covering in a very short time. And I guess a couple of things I just wanted to point out, just as Anna-Greta said, and as Jacob just said, this is this is an industry with a very huge impact. So think about this and this and this. These things are cumulative in terms of how they impact on our environment and then our health and well-being. So just very quickly, because I think probably most of you know about fracking, just to say that we have conventional and unconventional gas. So it used to be we could get gas out of very contained areas and not have to work too hard because the gas is quite concentrated in a small area. But with the advent of hydraulic fracturing or fracking, what we call, as well as longitudinal drilling, and also now multi-directional drilling, we go much deeper in from the coal seams, from coal bed methane, or what we call coal seam gas, closer to the surface. But now what Australia is courting is, for the first time, a major efforts in terms of shale gas, which goes several kilometers below the surface down to this, the shale beds very deeply, and always requires, or almost always requires, hydraulic fracturing, not just once, but many times. So just want to say this is really important that we think about. We do call this sort of fracking as a way of communicating, but actually there are so many parts of this unconventional gas and even conventional gas that impact on our lives, and actually come right in, spreading right across large areas with enormous footprints oftentimes. So this is from Texas, oil and gas fracking in Wickett. This is as concentrated as it can be. And just reflecting on what Anna-Greta shared with you, it impacts upon all those things, all those basic human needs that Anna-Greta mentioned. So another big aspect, and what I really want to focus on tonight, is the amount of literature that we now have and is now pointing in the direction that the things that were feared before are now being realized and being measured and being published about. So this is the Physicians and Scientists and Engineers for Healthy Energy, the PSE group in America, has been collecting these peer-reviewed papers for a number of years. And you can see how this literature has grown enormously from when we first started to look at this issue back in 2014. And I put these little states here. This is, oops, sorry. Jumping on me. These arrows here are when states were looking at and having inquiries about this industry. So the emphasis here is how little there was available in 2014, 2015, that decisions and policies were being shaped around. And even the Northern Territory fracking inquiry, the most recent, around 2017, 2018, we know so much more about this industry now than was taken into consideration in those determinations about how going forward, etc. So over the past few weeks, as Jacob has mentioned, we've really just dove back into the newest literature, and we're providing a report that's actually a real update across these things. And I love to start back when I think about this industry and the health impacts. It's classic paper by John Adgate and colleagues back in 2014 reminds us that the multiple layers of experience people have in terms of exposure to both chemicals, but also the changes in the social environment, as well as around us all, our water quality, air quality, and ultimately the global climate. So I'll go quite quickly here. What I want you to be taking in is how much evidence there now is around things that we were concerned about way back in 2014, 2013, and now are very much verified. One is the enormous number of chemicals in the drilling and hydrofracking fluid and naturally occurring in the wastewater, and the multiple ways that these chemicals, should people get exposed to them at sufficient quantities, the impacts that can occur from damaging tissue to carcinogens, teratogens impacting on fetal development in the uterus, reproductive toxicity, developmental toxicity, neurodevelopmental toxins, neurotoxins, and endocrine disrupting chemicals. And I'll just point, I think, here there is around 137 peer-reviewed publications in the PSE repository that have brought up multiple occurrences of defects chemicals, other volatile organics, methane, oxides of nitrogen, hydrogen sulfide, formaldehyde. You can read them all here. And I wanted to particularly point out too, just because people don't know too much about, we're not familiar with endocrine disrupting chemicals, but I'll come to that point in a moment. Now, and as well as the chemicals in the water, we also have a major chemical exposures in the air. And this paper by Garcia Gonzalez et al. Mapped out the various different chemicals that get released into the atmosphere throughout the multiple stages of the oil and gas production process, from the exploration right to the processing, so the drilling into fracking and well stimulation and completion, the processing of the gas, the transportation of it, and also its storage. And then it gets on ships when it turns into LNG, liquefied natural gas here in Australia, since a great deal of our gas is exported. So chemicals right throughout that process. There's also quite a major literature on how those chemicals can get into our water as well, so that it gets emitted into the atmosphere, but also many stages where this contaminated water coming up containing both fracking chemicals and naturally occurring chemicals. There are multiple ways that go wrong along that pathway and lead to contamination of the environment. And that literature has very much exploded in the last few years. The prominent chemicals in that wastewater include volatile organics. Again, first I should say that there's thousands of chemicals, and many of them have not been assessed. So we don't know the dangers that they might be posing, but we do know that this list here is all of these chemicals are of great health concern should people get exposed to levels that are capable of causing those changes that were mentioned before, from carcinogens to teratogens, tissue damaging chemicals, etc. So you can see the range of those here. And just to point out, there are at least 43 peer-reviewed publications on pathways to contamination, 61 on methane contamination, and 75 on chemicals and additives in the physician scientists and engineers for energy repository. And those are all available. You can get those. I just want to really quickly mention endocrine disrupting chemicals. It's not something we're familiar with, we talk about very much, but they are of great concern. The multiple pathways that they can interfere with in our normal metabolism, and especially during fetal development and growth, etc., interfering with the way that our body's regulate and communicate with itself. Sorry, my battery just said. So this is just showing that upstream of wells, those in a number of samples taken around wells, those endocrine disrupting activities weren't present, but in samples collected downstream, you can see those activities increasing. The American Academy of Pediatrics provided this wonderful diagram to think about, well, when we've got air pollution or water pollution, what are the sorts of things we would expect to be seeing amongst people who are exposed to those chemicals? And we can see alterations in birth outcomes, in childhood outcomes, and in adult health outcomes and impacts. And these are known impacts of exposures to these chemicals. And when we look at the literature specifically on oil and gas and people who are living close to these operations, and remember, it's not just the wells, it's also the ancillary processes as well, that have been published in the literature showing evidence of both symptoms and markers of disease. So these can include migraine headaches, sinus, nasal irritation, nausea, eye irritation, and particularly asthma worsening, which requires medication. Sorry, my computer is threatening me to. There, okay, good. So, and also hospitalizations, and this includes for acute heart attacks, heart failure, respiratory, neurological disorders, and people with existing asthma having to go to the emergency department and inpatient, and for cancers and immune-related diseases. And here are just some of the many publications that have shown spatial relationships between gas operations and increased prevalence or severity of these conditions. Also, some very recent and very groundbreaking studies on deaths and reduced life expectancy from cancers, cardiovascular and respiratory disease, and from all causes. So these, as we go through time, we see more and more rigor in these. The studies have gotten very large, and the precision in terms of estimating exposure as well as recording these health impacts has become very, very elegant. Also, we see mental health conditions. There's a little bit of literature there showing that depression, anxiety increasing amongst those having to deal with these industry in their everyday lives, sexually transmitted infections, and also pedestrian and traffic injuries and fatalities. And also on the early in life, there is a very large growing literature on the different impacts on pregnancy in terms of antenatal depression and anxiety, hypertension, preeclampsia, as well as birth outcomes, smaller babies, preterm and extreme preterm deliveries, spontaneous abortions, as well as very serious birth defects. That literature is growing each year, as you can see from those recency of publications. And asthma exacerbations, as mentioned earlier, amongst children, and childhood acute lymphoblastic leukemia. And that's linked to pre-birth exposures. Some of this work is so incredibly elegant. I'll just show you one here really quickly. Almost 1 million Ohio births. So Ohio is a place of quite intense gas development over 7 years, investigating those who were living within 10 kilometers of oil and gas activities, found increases odds ratios across structural, neural tube and congenital heart defects and oral clefts. So these are very concerning findings. And another very major study published just this month, a few weeks ago, by Jonathan Bonacore and colleagues, mapped out the emissions from oil and gas operations, plotted out their dispersion of these pollutants across the United States. And as you can see down on this table 2, we can see premature deaths, 7,500 estimated from these exposures, also modeling the health outcomes as well. Asthma incidents, about 410,000 additional and asthma exacerbations and heart attacks, etc. And also determining the monetary value of these health impacts, the losses to the community between premature deaths and health care delivery for all of those health impacts totaled up to $77 billion in 2016. So that's in 1 year alone. And it's in a year, and now there are many, many more oil and gas wells in the country. So we're talking about a huge bill that the community is paying for in our health and well-being, as well as economically. I know time is getting short. I just wanted to say that the loss of physical, psychosocial well-being and mental health. There is also a vast literature on all kinds of ways in which the oil and gas operations coming into a community results in a vast range of stressors and things that will exacerbate any health problems that people have, as well as creating mental health issues that then make them more susceptible to physical health issues as well. We cannot, this needs to be taken into consideration very seriously. And also to say that, as Anna Greta was saying, that climate change will make all of these exacerbations even worse in terms of people's ability to deal with this industry in their communities. And certainly, as Jacob pointed out, for Aboriginal people, this is an extraordinarily important issue not to forget about. Also, there are concerns, there's a literature about sexual violence against women and children, especially in remote areas, because of the influx of so many workers. This is a huge industry that brings in truck movements, workers, man camps, etc. These are documented influences in Canada and the United States. And just last year, we had a very serious inquiry in Western Australia about the sexual abuse and harassment of women in the FIFO mining industry. So we know that that behavior is there as well. So as Anna Greta talked about, the climate system and our ecosystems vastly affected by this industry. Essentially, we're uncovering a whole massive quantity of carbon that was safely stored down under in the coal and down in the shale, and this industry is releasing that carbon back up in the atmosphere, either as methane, fugitive emissions, or as CO2 when the gas is burned. And this is a very recent paper which is argued that unconventional gas and the continued use of gas is just as bad as coal mining. So it is not a cleaner, greener bridge to renewables. It is as serious, at least, as coal. And just briefly, Australia isn't doing that well in our reductions of energy. We are doing a really great job in terms of getting coal out of our domestic energy systems. But this excerpt from Australia's national greenhouse gases, the most recent, has pointed out that despite those downturns in terms of coal and the increases in renewables in our energy system, LNG exports have increased by 204%, and that is particularly a driver in emissions going upwards as far as stationary energy, excluding electricity. Australia signed a global methane pledge in October 2022, committing Australia to reductions in methane, which is extremely potent greenhouse gas, 85 times more potent than carbon dioxide in a 20-year period. It is something we need to get down as fast as possible. And as you can see here, the contribution of fossil fuels to the methane in our atmosphere needs to be brought down very urgently in order to keep us with a reasonable, I shouldn't say reasonable, but to prevent our climate to really being a total catastrophe. We don't have much time. This is 2030, and we are in 2023. Also, just to say that Australia's fugitive emissions are going upwards as well. So LNG, again, pointing to LNG exports have increased, and this has ramped up our fugitive emissions as well, especially in the state of Queensland, where we have coal seam gas ever expanding. So despite all this, you'd think that we would be stepping up and really moving towards, as fast as we can, towards a free fall of carbon emissions and of reliance on fossil fuels. But as we look across the country, we see a number of states and territories looking to expand their oil and gas industries. And particularly just wanted to point out that one of the first cabs off the rank appears to be Beetaloo. And just in May this year, it was given a green light to proceed. So a lot of approvals were being made. Look, there's many approvals that need to be done. So there's still windows of time to be able to say, no, this is not good for the country. Beginning a brand new shale gas industry in 2023 is not a good idea if we truly want to play our role in terms of responding to climate change. The biggest thing isn't our domestic emissions. They are coming down very well, but it's the scope 3 emissions. It's those emissions that occur when we export this in the liquefied natural gas to be put into probably very leaky municipal systems of gas distribution. That we're talking enormous methane emissions, as well as here in Australia. So we are not going to be able to offset the amount of scope 1 and 2 emissions that we can see. It's not happening in Queensland, and it's hard to see how it would happen if we had a major increase. So I just want to point out quickly that we wrote a little conversation piece last year, and I particularly wanted to acknowledge Professor David Shearman, who is a very important person in terms of what we're doing right now. And just talking about some of the challenges that the Beetaloo Basin would face should this proceed. But as Jacob has told us about, there is so much strength, there's so much dedication and energy, and so much leadership amongst Aboriginal and Torres Strait Islander people around not proceeding with these kinds of operations, protecting their country. And I just wanted to express my immense gratitude to all of the Aboriginal and Torres Strait Islander people who are pushing against and pushing our government to take that action that we actually need. And the Nurtulungi Aboriginal Corporation is a real leader in the Northern Territory. So just in closing, I just want to, just getting back a little bit to what Anna Greta was showing you, but on the opposite direction of in terms of complexity. So back in 2011, my colleague Marcia Grand-Ortega and I, we mapped out our concerns at that time, what people were talking about. And if you look at that ring around there, we were worried about the safety of our communities, the security of our landscape, biodiversity, culture, natural heritage, the security of our agriculture and food supplies, the risk to our economic well-being, risk to air quality, aquifers, water catchments, security of our climate, which is already in crisis, and very importantly, the well-being of our young people and our families. And unfortunately, in 2023, reviewing this immense literature now, we're seeing that this has now become evidence-based. Many of the things we worried about have definitely occurred in the United States, and we are at risk of the same here should we expand. So just in closing, I'd like to say that right now, Professor David Shearman, Jacob and we are updating a 2019 report that we produced on the implications of health and well-being of expanding gas mining in Australia. We're doing this again for 2023, and we'll have that report very soon. And it will detail this literature that we've skated over really quickly tonight. So thank you very much.
Oh, look, thank you, Melissa, and thank you, Jacob. That was such a hard-hitting, really, really impressive presentation, and just it's hard not to be quite overwhelmed by it all, to be honest. You know, like I'm quite angry. You know, I'm feeling a lot of anger here, and it just seems so, it's a monstrous badness. You know, like you talked about, there were these things that we don't know, you know, some of the chemicals, etc. But what we do know is so absolutely horrifying and overwhelming. It just seems like how, you know, what kind of stupid person could allow something like that to continue? And I did think it was interesting how you talked about the level of evidence and how much that's just really increasing over time, and perhaps, you know, some decisions were made like for NT in 2017, and, you know, people might be using that as an excuse not to know, but, you know, it's pretty obvious, right? I have one question in the chat that I would like to ask you about groundwater. So could you just, you know, touch on that for us, please, Melissa? So, you know, and I've actually sat next to an oil exec who told me that fracking doesn't impact groundwater at a dinner once. And, you know, I would have loved to have a better rebuttal at the time. So if you could give me something on that, that'd be great.
Yes, sure. I had to rush through that slide, which showed the multiple ways that surface water can be impacted, as well as groundwater. A couple of the things, so they used to say there's no evidence whatsoever that fracking is ever contaminated water supplies. That cannot be said anymore. There's many verifications in the States, and particularly places like Pennsylvania, which rely completely on wells. There's multiple cases of methane getting into their groundwater and coming in and coming out the sink. We've seen it before, but it is very real and very true. There are multiple ways it happens. It can happen through wells that are not well put in place, they're faulty. But it also appears there's more and more evidence that the depressurizing of water causes the water to migrate higher up through cracks and through various aspects of the ground. So that what that's saying is this is a very slow process. We won't be able to know until it's well and truly done. But it's growing, that even if it's all done nice and perfectly, these physics of groundwater may still cause major contamination of groundwater.
Yeah, so it's just anyone who's trying to tell me that that's not true is just uninformed, really, and maybe not telling me the whole truth. I suppose that's one way of putting it. And another question we've got is, you know, do you think within the industry, you know, within the gas industry, is there any recognition? Have we ever seen them acknowledge the health effects themselves, or are they just not paying attention to that information?
I think we've seen in a number of evaluations and things like that by proponents. They often, we all know like, how long did it take us to actually hit back at tobacco companies, despite the growing body of literature? And now who would deny that smoking is very harmful to health? In this case, we see researchers belittled. We see emphasis on the fact that there are limitations of research, I should say that, in terms of confounders that might not have been measured. We can go on and on, but I will say that recent literature, the health economists have come into this field in a big way, and they've brought this methodology called difference in differences. It's a very powerful methodology that gives you both temporal and spatial picture of what's happening and how health outcomes appear after the drilling, after the materials. And also it controls for many confounders because it's in the same population before and after. So it's a very powerful technique.
That's wonderful, isn't it? I always admire the way different people, approach these problems and give us ways through to answer things that somehow, sometimes can seem impenetrable.
Yeah.
This is a question, I might ask this one to you, Jacob, please. Just because of the Northern Rivers experience that you had, it's really about how do we bring people together? Like, was there anything that, you observed in that struggle that you could, share with us about that, that concept of bringing all the different groups together so that we unite to, create something helpful?
Yeah, it's a tricky one, particularly in the Northern Rivers and particularly within Aboriginal communities. It's natural landmarks that bring a lot of people together. I grew up on the Clarence River in Grafton, and there were many plans by many politicians to change the mapping of that river and divert water places, and absolute protest against it. It was the one thing that everyone could come together and say, don't touch our river. This is the natural thing that everything around here lives by. And it sort of it integrates well with what you were saying about the wastewater and the a lot of irrigation for agriculture around the country is used for these freshwater basins. And in the literature, we're finding that agriculture don't really have a choice anymore. They're starting to use, particularly in America, they're starting to use wastewater from these, fracking sites. And food security, I think, is going to be something this country really needs to have we need to have a good look at ourselves. It's something I think the rest of the world looks at Australia for its extremely high quality of food security. And if we continue down this path, particularly with the water, I fear that will change very quickly. But yeah, it's about finding that one thing that it unites everyone. And the problem with, as I said, the logistical challenges with the Beetaloo, it's just such a logistical nightmare to bring everyone together. But once you find that one uniting factor, we found it was the natural landmarks. I think everyone stands up and says, this isn't right and we need to fight this.
Yeah, and I suppose that's the thing, isn't it? It isn't right, and we really do need to fight this. And so, Anna Greta, I'd like you to maybe, tell us a bit about what's happening regarding trying to do something around Beetaloo and how we are trying to bring together as many different voices as we can, but of course the health voice in stopping that awful project.
Yeah, well, look, I have to start by just shouting out to Louise Woodward, who's in the audience, and she probably should be the one who's doing the talking about this. Louise has brought together more than 90% of the paediatricians in the Northern Territory, really deeply concerned about the Beetaloo Basin, so about the direct impacts of gas fracking on that community in the Beetaloo Basin, also directly concerned about the health impacts of the middle arm development. And we haven't talked about middle arm very much, but for those who haven't heard that phrase, middle arm, this is a large precinct area. It's about 1,500 hectares, just near Darwin. It's about 3 kilometres from the outskirts of Darwin. It's on Darwin Harbour. And it's proposed it's called being labelled as a sustainability hub. It's not. It's an LNG export hub that will be the way in which the gas from the Beetaloo Basin is then shipped out overseas. It'll be a gas processing site, so it's a petrochemical processing site. And there may be processing there for hydrogen, either blue or green hydrogen, or potentially other minerals. And so there's some blurring around the role for middle arm. But middle arm quite clearly is the linchpin for the success of a Beetaloo Basin gas fracking. Just to talk again about the magnitude of Beetaloo, it's actually quite hard to get our head around it.
Yeah.
I know every single person who is on the call tonight has thought about their own personal carbon footprint. They're almost always going to be working in their organisation at how to decarbonise or how to decrease the carbon footprint in the workplace that you might be in the hospital or in the health service more broadly. The Beetaloo Basin, when underway, will be more than 20% of Australia's carbon pollution. More than 20%. It's the biggest project by orders of magnitude, and it's facilitated by going through Middle Arm in Darwin. And so the potential impacts here for that community who are affected directly by the air pollution, by the soil contamination, by the water contamination from the gas fracking process, that is a really significant issue in the Northern Territory. It's a significant issue for air pollution around Darwin and potentially other chemical pollution, air, food and water pollution from Middle Arm. But for all of us, this is an existential threat to do with climate change. And so it's tremendously important that we work on it. And we are going to Canberra or coming to Canberra. People are coming to play with me. On the 8th of August, there's a day of action here in the ACT focused around Parliament House, supported by a couple of the independent members of Parliament, particularly David Pocock and Monique Ryan. Monique, of course, has worked in the Northern Territory as a paediatrician. And the goal of that day of action is to highlight that Middle Arm, which is funded by the federal government to $1.5 billion worth of federal government funding, that Northern Territory infrastructure of around $400 million will be supported for the gas industry there. And that amount of money, it's almost $2 billion worth of federal funding, really should be questioned in terms of the direct health impacts, the air pollution, the soil pollution, the water pollution that comes from gas fracking and gas processing, and the indirect health impacts of climate change that will affect all of us. And so we are going to spend as much time as we can between now and the 8th of August, and we will spend much more time afterwards, I suspect, talking loudly, talking regularly, talking strongly about the health impacts of gas fracking and the opportunity that we have as a country to really lead on making a choice not to do this.
Yes, that's it. And it's the choices that can be made. I mean, 1.5 billion, almost $2 billion, we could spend that money in other ways if we chose to. We could spend them in so many supportive, good ways that help our community. But the choices are made that just don't help us as humans, and don't help our country, and don't help the biodiversity that we rely on to live. Okay, well, look, thank you all so much. I think that's been a very powerful, very helpful, hard-hitting webinar. I think what we fundamentally found was, we know that climate change is a health issue. We know that the health effects of climate change are being felt now and across the globe, in Australia and across the globe. We can see that gas is a major contributor to climate change. And we can see that gas extraction has its own extremely detrimental health effects. And, they're broad and deep and much bigger than I think we're paying enough attention to. And when we try and stop these things, and it's terrible that we live in a world where we have to try and stop them, that's quite unjust in my mind. But that when we try and stop these things, it's about community coming together, that we unite as people and, stand up for our planet, stand up for ourselves, stand up for our communities, and try to do the right thing. So I know there's been a few links in the chat to, sign some petitions. I see the ACF petition there. I see the Eventbrite link there for the Day of Action in Canberra. I hope people can come to that. Those who can't come, there's other ways to be involved. You can see your politician anyway. You don't have to wait to Canberra. Go and visit them. They're our elected representatives. We elect them to represent us. We're allowed to tell them what we think. You can, learn about the health effects of fracking, talk about it amongst the people that try and talk up a storm about this, because Beetaloo is a monster, but there are other monsters in Australia out there that we're also going to need to stop. All right, thank you everybody so much for coming along tonight. I hope you've enjoyed the webinar. Good night, bye-bye.